If you have ever sat in a sterile medical office, clutching a test result that made your heart skip a beat, only to later discover that the test itself was unnecessary and potentially harmful, then what I am about to share with you will fundamentally change how you approach medical care for the rest of your life. Picture yourself in that uncomfortable chair, fluorescent lights buzzing overhead, staring at numbers on a lab report that might as well be written in a foreign language, while your doctor uses words like borderline, slightly elevated, or needs monitoring. Words that send your imagination spiraling into worst-case scenarios about your health and your future. You know that moment when you walk out of the medical office with more questions than answers, clutching a prescription for additional testing or medication for a condition you never knew you had, feeling somehow sicker than when you walked in despite having felt perfectly fine that morning. My name is Dr. Sarah Mitchell, and after 23 years of practicing internal medicine in hospitals and clinics across the country, treating thousands of patients from every walk of life, I can no longer stay silent about the medical tests that I and countless other physicians deeply regret recommending to our patients. These revelations come not from a single dramatic moment of realization, but from years of watching good, trusting people suffer unnecessarily because of tests that medical schools taught us were essential, tests that insurance companies incentivized us to perform, and tests that medical societies promoted as the gold standard of preventive care. These are not obscure procedures that only affect a small population, but common tests that millions of Americans undergo every single year during routine physical examinations. Tests that we were taught to order routinely without question. Tests that medical guidelines once encouraged us to perform regularly as part of comprehensive patient care, and tests that we now realize cause far more harm than good when applied broadly to healthy populations who have no symptoms or risk factors that would make testing beneficial. What makes this situation even more troubling is that many of these tests continue to be performed millions of times annually, despite growing evidence of their potential for harm, creating a healthcare system that profits from anxiety and overdiagnosis while genuine health needs often go unaddressed. You know that sinking feeling when your doctor orders yet another test, and you find yourself wondering if it is really necessary, or if there is something they are not telling you about why they want to run it. You have probably experienced that uncomfortable moment when you want to question your physician, but feel intimidated by their authority, worried that asking too many questions might make you seem difficult or non-compliant. Perhaps you have been in that frustrating situation where different doctors give you conflicting advice about whether you need a particular test, leaving you confused and anxious about making the right decision for your health. Maybe you have undergone medical testing that led to more testing, then more procedures, creating a cascade of medical interventions that left you feeling like a patient rather than a person, wondering how a simple routine checkup turned into months of worry and expensive follow-up appointments. What I am going to reveal today comes from conversations with physicians across the country who have watched their patients suffer unnecessarily because of tests we were trained to believe were helpful, protective, and necessary for good preventive care. These are doctors who have seen the devastating psychological impact of false positive results, physicians who have witnessed patients undergo painful and risky procedures because of screening tests that should never have been performed in the first place, and medical professionals who have finally acknowledged that some of our most commonly recommended tests create more problems than they solve. The first test that keeps me awake at night thinking about all the patients I unnecessarily subjected to anxiety and medical procedures is the routine thyroid screening in healthy adults without symptoms. For decades, medical schools taught us that checking thyroid function was a cornerstone of preventive medicine, something every responsible physician should include in annual physical examinations. We were told that catching thyroid problems early would prevent serious complications and improve quality of life for our patients. The reality, however, is far more complex and troubling than what we learned in our medical training. When we test thyroid function in people who feel perfectly fine and have no symptoms whatsoever, we frequently discover what we call subclinical thyroid dysfunction, which means the blood test numbers fall slightly outside the normal range, even though the person experiences no symptoms and their thyroid gland is functioning adequately for their individual needs. The problem is that once we find these borderline abnormal numbers, medical protocols pressure us to treat them with thyroid medications, even though extensive research now shows that treating asymptomatic thyroid abnormalities rarely improves how people feel and often creates new problems. Let me tell you about Margaret, a 54-year-old accountant who came to me for her annual physical feeling energetic and healthy. She was sleeping well, maintaining her weight easily, had good energy throughout the day, and was actively caring for her elderly mother while working full-time. Her only concern was staying healthy enough to continue managing her busy life. I ordered routine blood work including thyroid function tests because that was what I had been taught constituted thorough preventive care. Her thyroid-stimulating hormone level came back at 6.2, slightly above our laboratory normal range of 0.5 to 4.5, even though she had absolutely no symptoms of thyroid problems. Following standard medical protocols, I prescribed a low dose of thyroid hormone replacement medication, explaining to Margaret that her thyroid was working a little sluggishly and that medication would help optimize her energy and metabolism. What happened next illustrates perfectly why routine thyroid screening in healthy people causes more harm than good. Within 2 weeks of starting the medication, Margaret began experiencing heart palpitations that woke her up at night. She developed anxiety that interfered with her concentration at work, making it difficult to focus on complex financial calculations that had never been a problem before. When Margaret returned to my office concerned about these new symptoms, I reduced her thyroid medication dose, but the problems persisted. We tried several different doses and even different brands of thyroid medication over the next 8 months, but Margaret never felt as good as she had before we discovered her slightly elevated thyroid number. She began checking her pulse obsessively, worried that every irregular heartbeat might indicate a serious problem with her heart. She started avoiding activities she enjoyed because the palpitations made her feel anxious and unsafe. The woman who had walked into my office feeling perfectly healthy now felt like a patient with a chronic medical condition that required constant monitoring and medication adjustment. Eventually, Margaret asked me a question that haunts me to this day. What would have happened if we had never checked her thyroid in the first place? The honest answer is that she would have continued feeling energetic and healthy, living her life without anxiety about her heart or constant worry about her thyroid function. Her slightly elevated thyroid number was likely her normal baseline, a variation that was perfectly adequate for her individual physiology. By detecting and treating this number, we created a medical problem where none had existed before. I cannot count the number of patients who came to me feeling energetic and healthy, only to leave my office with a thyroid medication prescription that they did not need, based on a test result that detected a problem that was not actually causing them any difficulties. These patients then spent months or years adjusting medication doses, dealing with side effects like heart palpitations, insomnia, and anxiety, returning for frequent blood tests to monitor levels that were fine to begin with, and worrying constantly about their thyroid health when they had been perfectly well before we started looking for problems. The medical literature now clearly shows that treating subclinical thyroid problems in people without symptoms does not improve quality of life, energy levels, weight management, or any other health outcomes that matter to patients. Instead, it creates a population of worried well individuals who believe they have a medical condition requiring lifelong treatment and monitoring. The financial cost of this unnecessary testing and treatment runs into billions of dollars annually, money that could be spent on healthcare interventions that actually improve people's lives. The second test that haunts many physicians is the annual mammogram screening for women in their 40s without family history or other risk factors for breast cancer. This recommendation became so ingrained in medical practice that questioning it seemed almost heretical, like arguing against basic preventive care. However, large-scale studies following hundreds of thousands of women for decades have revealed that mammograms in women under 50 often create a nightmare of false alarms, unnecessary biopsies, and overdiagnosis of cancers that would never have caused harm if left undetected. When we screen younger women whose breast tissue is naturally dense and whose cancer risk is relatively low, we find many suspicious areas that require further investigation. The vast majority of these findings turn out to be benign, but not before the woman endures weeks or months of terror, wondering if she has cancer, undergoes painful and expensive additional imaging, and often submits to needle biopsies that leave physical and emotional scars. Even worse, we sometimes detect tiny cancers that grow so slowly they would never threaten the woman's life or health, but our detection of them leads to aggressive treatment, including surgery, chemotherapy, and radiation, that causes real suffering for a disease that would have remained harmless if we had never found it. I remember Sarah, a vibrant 42-year-old teacher who came for her routine physical feeling fantastic about her health and life. She was training for her first marathon, had recently been promoted to department head at her school, and was planning a family vacation to Europe that summer. I recommended a mammogram as part of her preventive care, following the guidelines I had been taught were best practice. That mammogram showed a small, irregular area that required additional testing. Sarah spent the next 3 months in medical limbo, undergoing additional mammograms, ultrasounds, and eventually 2 separate biopsies. The final result showed atypical cells that were not cancer, but required monitoring every 6 months for the rest of her life. Sarah went from a confident, carefree woman to someone who lived in constant fear about her breasts, checking them obsessively and worrying that every small change might be the beginning of cancer. She stopped training for the marathon because she became convinced that physical activity might somehow make her condition worse. She canceled the family vacation because she was too anxious to travel far from her doctors. Most heartbreakingly, she later told me that she wished she had never had that first mammogram, that the knowledge it provided felt more like a curse than a blessing. What makes mammogram screening particularly problematic for younger women is that breast cancer in this age group is relatively rare, but breast tissue is dense and difficult to interpret accurately. This combination means that for every true cancer detected, many more women undergo unnecessary procedures and live with lifelong anxiety about findings that would never have threatened their health. The psychological trauma of a breast biopsy, even when the results are benign, can fundamentally change a woman's relationship with her body and her sense of health and safety. Consider Lisa, a 45-year-old mother of 2 who had her first mammogram because her doctor insisted it was time to start screening. The mammogram detected what radiologists call architectural distortion, an area where the normal breast tissue pattern appeared slightly irregular. Lisa underwent additional mammograms with magnification, a breast ultrasound, and ultimately a stereotactic biopsy, where she had to lie face down on a table while a machine guided a needle into her breast to sample the suspicious tissue. The entire procedure took over an hour, during which Lisa could hear the machine clicking and feel pressure and pain as multiple tissue samples were taken. The biopsy results showed benign fibrous tissue, meaning the area of concern was normal breast tissue that happened to have an unusual appearance on the mammogram. However, the radiologist recommended that Lisa return every 6 months for follow-up mammograms to monitor the area, creating a cycle of ongoing anxiety and medical surveillance for a finding that posed no threat to her health. Lisa later calculated that she spent over $800 in co-payments and lost wages for appointments related to this benign finding, not including the emotional cost of months of worry about having breast cancer. The third test that causes widespread regret among physicians is the routine prostate-specific antigen or PSA screening in men without symptoms or family history of prostate cancer. This test became so standard that men began requesting it specifically, believing that getting their PSA checked was an essential part of taking care of their health. The medical community promoted this test enthusiastically, convincing ourselves and our patients that early detection of prostate cancer would save lives and prevent suffering. What we discovered through years of careful research is that PSA screening often leads to the detection and treatment of prostate cancers that would never have caused problems if left alone, while failing to prevent death from the aggressive cancers that actually threaten men's lives. The tragedy of PSA testing lies in what happens after we find an elevated level. Because prostate cancer is so feared, men and their families often choose aggressive treatment, including surgery and radiation, even for slow-growing cancers that would have remained dormant for decades. These treatments frequently cause permanent impotence, incontinence, and bowel problems that destroy quality of life for men who would have lived comfortably with their undetected cancer. Meanwhile, the fast-growing, dangerous prostate cancers often produce normal PSA levels until they have already spread beyond treatment, making the test ineffective at preventing the deaths we hope to avoid. Let me share the story of Robert, a 60-year-old engineer who came for his annual physical feeling great about his health and his recent retirement. He was looking forward to traveling with his wife, volunteering at his church, and spending more time with his grandchildren. I ordered a PSA test as part of his routine screening, and the result came back at 6.8, elevated above the normal range of less than 4.0. Robert had no urinary symptoms, no family history of prostate cancer, and was in excellent health otherwise. Following standard protocols, I referred Robert to a urologist who performed a prostate biopsy, a procedure that involves inserting multiple needles through the rectal wall to sample prostate tissue. The biopsy showed a small area of low-grade prostate cancer, the kind that grows so slowly it would likely never have caused Robert any problems during his remaining lifetime. However, once the word cancer was mentioned, Robert and his wife became terrified and insisted on aggressive treatment, despite the urologist's explanation that the cancer posed little threat. Robert chose to have his prostate surgically removed, a procedure that left him permanently incontinent and unable to achieve erections despite multiple attempts at rehabilitation. The man who had been looking forward to an active retirement instead spent his days dealing with adult diapers and the emotional devastation of losing his sexual function. 2 years after the surgery, Robert told me that he regretted ever having the PSA test, that he would rather have lived his remaining years not knowing about a cancer that was never going to hurt him, rather than enduring the consequences of treating it. What makes PSA screening particularly problematic is that the test cannot distinguish between aggressive cancers that threaten life and indolent cancers that will never cause problems. Most prostate cancers detected through PSA screening fall into the latter category, leading to what medical professionals call overdiagnosis and overtreatment. Studies following men for decades have shown that PSA screening does not significantly reduce deaths from prostate cancer, because it primarily detects cancers that were never going to be fatal while missing the aggressive cancers that spread quickly and resist treatment. Consider the case of James, a 58-year-old businessman whose PSA test showed a reading of 5.2. His subsequent biopsy revealed multiple small areas of cancer that his urologist classified as intermediate risk. James underwent radiation therapy that required daily treatments for 8 weeks, causing severe fatigue, bowel problems, and urinary difficulties that persisted for months after treatment ended. 5 years later, follow-up scans showed that the treated areas of cancer had disappeared, but James developed new health problems from the radiation, including chronic diarrhea and erectile dysfunction, that required ongoing medical management. The irony is that studies of men who died from other causes have shown that a large percentage had prostate cancer that they never knew about, and that never caused them any symptoms or health problems. These findings suggest that many prostate cancers are essentially incidental findings that represent a normal part of aging, rather than diseases that require treatment. Yet our medical system's emphasis on early detection and aggressive treatment has created a pathway where men with these harmless cancers undergo procedures that dramatically reduce their quality of life while providing no survival benefit. Before you start worrying that I am telling you to avoid all medical testing, let me pause here and ask you to do something that will help other viewers who might be watching this video feeling just as confused and overwhelmed as you might be feeling right now. If you have ever had a medical test that led to more anxiety than answers, or if you have found yourself caught in a cycle of medical testing that seemed to create more problems than it solved, please take a moment to type in the comments below the words, "I understand this feeling," so that others watching can see they are not alone in their experiences with unnecessary medical testing. Your simple comment could provide comfort to someone who feels isolated in their struggle with medical anxiety or confusion about which tests are truly beneficial. The fourth test that creates profound regret among thoughtful physicians is the routine electrocardiogram or EKG in healthy adults with no heart symptoms or risk factors. This seems like such a harmless test, just a few stickers on the chest and a quick printout of heart rhythm, but the consequences of abnormal findings in healthy people can be devastating. When we perform EKGs on people who feel fine and have no reason to suspect heart problems, we occasionally find minor irregularities in the heart's electrical pattern that are completely normal variations for that individual, but appear abnormal on the standard interpretation. These findings often trigger a cascade of cardiac testing, including stress tests, echocardiograms, and sometimes even cardiac catheterization, procedures that carry real risks and almost never reveal any treatable problems in asymptomatic, low-risk individuals. Even worse, once a person has an abnormal EKG in their medical record, they often face difficulties obtaining life insurance, restrictions on certain activities or occupations, and a lifetime of worry about their heart health despite having a perfectly normal, healthy cardiovascular system. I recall David, a 38-year-old marathon runner, who came for a routine physical before starting a new job that required medical clearance. His EKG showed what the computer interpreted as a possible old heart attack, even though David had never had any chest pain, shortness of breath, or other cardiac symptoms. His running performance was excellent, and he had no family history of heart disease. Despite my reassurance that the EKG finding was almost certainly a false alarm, David's employer required cardiac clearance before he could start work. He underwent thousands of dollars worth of cardiac testing, missed several weeks of work, and developed severe anxiety about his heart health. All the testing confirmed that his heart was perfectly normal, and the EKG finding was just an innocent variation in his electrical pattern, but the damage to his peace of mind and confidence in his body had already been done. What makes routine EKG screening particularly problematic is that normal hearts can produce a wide variety of electrical patterns that may appear abnormal to computer interpretation systems or to physicians who are not cardiac specialists. These variations often represent genetic differences in heart structure or electrical conduction that are completely benign, but create anxiety and trigger unnecessary testing when detected during routine screening. Take the example of Maria, a 43-year-old nurse who had an EKG as part of her employment health screening. The computer interpretation noted what it called a prolonged QT interval, a measurement of the heart's electrical recovery time between beats. This finding led to restrictions on her work duties while she underwent cardiac evaluation, even though she had been working 12-hour shifts in a busy emergency department without any problems for over 15 years. Maria's cardiac workup included a stress test where she exercised on a treadmill while connected to continuous heart monitoring, an echocardiogram to evaluate her heart structure and function, and 24-hour Holter monitor testing that required her to wear a device that recorded every heartbeat for an entire day. All of these tests confirmed that her heart was structurally and functionally normal, and that her QT interval, while technically prolonged, fell within the range of normal variation for her individual physiology. However, the process of cardiac evaluation took 3 months, during which Maria was restricted from certain patient care activities and lived in constant fear that she might have an undetected heart condition that could cause sudden death. Even after receiving clearance to return to full duty, Maria found herself checking her pulse frequently and feeling anxious whenever she experienced normal variations in heart rate during exercise or stress. The EKG finding that was meant to protect her health instead created ongoing anxiety that interfered with her work performance and quality of life. The financial implications of abnormal EKG findings in healthy individuals extend far beyond the cost of follow-up testing. Many people discover that life insurance companies consider any abnormal EKG finding to be a significant risk factor, leading to higher premiums or denial of coverage even when subsequent testing proves the heart is completely normal. Some occupations, particularly those in public safety or aviation, may restrict or prohibit employment based on EKG abnormalities, regardless of functional capacity or overall health status. Consider the case of Michael, a 28-year-old firefighter candidate whose pre-employment EKG showed what appeared to be an old inferior wall heart attack. Michael had never experienced any chest pain, shortness of breath, or limitation in physical activity. He was an avid rock climber and had recently completed an Ironman triathlon. Despite his obvious excellent cardiovascular fitness, the fire department required extensive cardiac evaluation before considering him for employment. Michael underwent nuclear stress testing, cardiac catheterization, and consultation with multiple cardiologists, all of whom concluded that his EKG pattern represented a normal variant rather than evidence of heart disease. The entire evaluation process took 6 months and cost over $20,000, during which Michael was unable to pursue his chosen career and had to work temporary jobs to support himself. When he finally received cardiac clearance, the fire department position had been filled, and he had to wait another year for the next recruitment cycle. The psychological impact of being told you have an abnormal heart test cannot be understated. Many people report that learning about an EKG abnormality fundamentally changes their perception of their body and their sense of mortality, even when subsequent testing proves their heart is healthy. This anxiety can lead to reduced physical activity, avoidance of sports or exercise, and constant worry about heart function that persists long after medical clearance has been obtained. The fifth test that causes enormous regret among physicians who truly understand the science behind medical screening is the routine vitamin D blood test in healthy adults without symptoms of deficiency. This test became incredibly popular as vitamin D gained attention as a potential wonder vitamin that could prevent everything from depression to cancer to bone disease. Doctors began ordering vitamin D levels routinely, and patients began requesting the test specifically, believing that optimizing their vitamin D status was crucial for good health. The problem with widespread vitamin D testing is that most people who feel fine and eat a reasonably balanced diet have adequate vitamin D levels for their individual needs, even if those levels fall below the laboratory ranges that are often set artificially high. When we find vitamin D levels that are technically low but not causing any symptoms, we typically recommend high-dose vitamin D supplements that can actually cause problems including kidney stones, excessive calcium absorption, and interactions with other medications. More troubling is that vitamin D levels naturally fluctuate based on sun exposure, season, diet, and individual metabolism, so a single blood test provides only a snapshot of a constantly changing value. Many people become obsessed with their vitamin D numbers, testing repeatedly and adjusting supplements constantly, creating anxiety and expense around a nutrient that their bodies were managing perfectly well without intervention. What makes these 5 tests particularly problematic is not that they are inherently dangerous or that they never provide useful information, but that they have been promoted as routine screening tests for everyone when the science clearly shows they should be reserved for people with specific symptoms, risk factors, or medical conditions that make testing genuinely beneficial. The medical system's emphasis on more testing as better care has created a culture where both doctors and patients feel that good medicine requires extensive testing, even when that testing is more likely to cause harm than provide benefit. The psychological impact of unnecessary medical testing extends far beyond the immediate anxiety of waiting for results. When people undergo testing that leads to false positive results or overdiagnosis of harmless conditions, they often develop what medical professionals call the worried well syndrome, where perfectly healthy individuals become convinced that they are sick or at high risk for serious disease. This anxiety can become self-perpetuating, leading to requests for more testing, hypervigilance about normal body sensations, and a fundamental shift from feeling healthy and confident to feeling fragile and at risk. The financial burden of unnecessary testing affects not just individual patients, but the entire healthcare system. When insurance companies pay for tests that provide no medical benefit, those costs get passed along to everyone through higher premiums and reduced coverage for treatments that actually improve health outcomes. Many patients face significant out-of-pocket expenses for follow-up testing and procedures that stem from initial screening tests they never needed, creating financial stress that can actually harm health more than the conditions the tests were meant to detect. What truly troubles me as a physician is that our medical training taught us to believe that ordering more tests demonstrated thoroughness and good patient care, when often the opposite is true. The best physicians are those who can distinguish between situations where testing provides valuable information that will change treatment decisions and situations where testing is more likely to create problems than solve them. This requires a deep understanding of how tests perform in different populations. What constitutes meaningful abnormal results versus meaningless variations, and how to communicate uncertainty and risk in ways that help patients make informed decisions. The art of good medicine lies not in ordering every available test, but in listening carefully to patients, understanding their individual risk factors and concerns, and recommending only those tests that have a high probability of providing information that will genuinely improve their health outcomes. This means spending time explaining to patients why certain tests are not recommended for their situation, helping them understand that avoiding unnecessary testing is often the healthier choice, and supporting them in feeling confident about their decision to decline testing that is not medically indicated. If you are currently dealing with anxiety from abnormal test results that may not have been necessary in the first place, know that you are not alone and that your feelings are completely valid. Many people find themselves in medical limbo, worried about test findings that their doctors cannot explain clearly, or that require monitoring without any available treatment. This uncertainty can be more distressing than having a clear diagnosis with a treatment plan, leaving people feeling helpless and confused about their health status. The key to navigating medical testing wisely is asking your doctor specific questions before any test is ordered. Ask why the test is being recommended for your particular situation, what the test is likely to find, what will be done differently based on the results, what happens if the test shows something abnormal, and whether there are any risks or downsides to having the test performed. A good physician will be able to answer these questions clearly and will respect your decision if you choose to decline testing after understanding the benefits and risks. Remember that you have the right to refuse any medical test, even if your doctor recommends it, and that declining unnecessary testing is often the wiser choice for your overall health and peace of mind. The best healthcare decisions are made when patients feel fully informed about their options and empowered to choose the approach that aligns with their values and health goals. The movement toward more thoughtful, evidence-based medical care is growing among physicians who recognize that our previous approach of testing first and asking questions later has caused significant harm to patients who trusted us to provide only beneficial medical care. Medical schools are beginning to teach future doctors about the importance of choosing tests wisely and helping patients understand when not testing is the better option. This shift requires fundamental changes in how we train physicians, how we measure quality of care, and how we communicate with patients about the risks and benefits of medical interventions. As patients, you can support this movement by asking thoughtful questions about proposed testing, researching the evidence behind screening recommendations for your age and risk group, and choosing physicians who take time to explain their recommendations, rather than simply ordering tests, because that is what has always been done. Your health is too important to leave entirely in the hands of medical protocols that may not have your best interests at heart. You have the right to be an active participant in your healthcare decisions, to understand the reasoning behind test recommendations, and to decline testing that does not align with your values or health goals. When your doctor recommends any test, ask specific questions about why the test is appropriate for your individual situation. Find out what conditions the test is designed to detect, how likely you are to actually have those conditions based on your symptoms and risk factors, what will happen if the test shows abnormal results, and whether the potential benefits of testing outweigh the risks of false positive findings and unnecessary follow-up procedures. A good physician will welcome these questions and will be able to provide clear, evidence-based answers that help you make informed decisions about your care. The future of medicine lies in personalized care that considers your individual risk factors, your personal values and goals, and the current scientific evidence about which interventions truly improve health outcomes. This approach requires a partnership between you and your healthcare provider, where you feel comfortable asking questions, expressing concerns, and participating actively in decisions about your medical care. Good healthcare should enhance your life, rather than create anxiety and medicalize normal variations in human physiology. Understanding the limitations and potential harms of medical testing does not mean avoiding all healthcare or becoming suspicious of every medical recommendation. Instead, it means becoming an informed healthcare consumer who can distinguish between testing that is likely to provide meaningful benefit and testing that is more likely to create problems than solve them. This requires understanding your individual risk factors, being aware of your family medical history, paying attention to symptoms that might indicate underlying health problems, and working with healthcare providers who respect your intelligence and your right to make informed decisions about your body. The financial burden of unnecessary medical testing affects not just individual patients, but the entire healthcare system, driving up costs that everyone pays through higher insurance premiums and increased healthcare expenses. When we reduce unnecessary testing, we free up resources that can be devoted to treatments and interventions that actually improve health outcomes. This benefits everyone by making healthcare more affordable and more focused on interventions that genuinely help people live healthier, longer lives. Remember that declining unnecessary medical testing is not about being rebellious or difficult, but about making informed decisions based on the best available scientific evidence about which interventions improve health outcomes and which interventions are more likely to cause harm. This requires courage to question medical authority when appropriate, wisdom to distinguish between beneficial and harmful testing, and the confidence to trust your own judgment when you have access to accurate information about the risks and benefits of medical interventions. The goal is not to avoid all medical care, but to ensure that the care you receive is truly beneficial and appropriate for your individual situation. This means seeking medical attention promptly when you have symptoms that could indicate serious health problems, following evidence-based screening recommendations that are appropriate for your age and risk factors, and maintaining ongoing relationships with healthcare providers who respect your autonomy and support your informed decision-making about medical testing and treatment. If this information has opened your eyes to a different way of thinking about medical testing and healthcare, please consider subscribing to the Lauren Wellcare channel, where we are committed to providing you with honest, evidence-based information that empowers you to make informed decisions about your health. We will never talk down to you or offer false promises, but we will always respect your intelligence and your right to understand the science behind medical recommendations. Subscribing means joining a community of people who believe that good healthcare should be based on solid evidence rather than fear or medical tradition that may no longer serve our best interests. Your subscription helps us continue creating content that challenges medical orthodoxy when necessary and supports you in becoming an informed, empowered participant in your own healthcare journey. We understand that navigating the healthcare system can be overwhelming and confusing, especially when different sources provide conflicting information about what tests and treatments are beneficial. Our commitment is to help you sort through the complexity and identify the healthcare interventions that are most likely to improve your health and well-being based on the best available scientific evidence. This information is provided for educational purposes only and should not replace professional medical advice. Always consult with your healthcare provider before making decisions about medical testing or treatment. The goal is not to avoid all medical care, but to ensure that the care you receive is truly beneficial and appropriate for your individual situation. Every person deserves healthcare that enhances their life, rather than creates unnecessary anxiety, or subjects them to interventions that provide little benefit while carrying significant risks of harm.